Ever felt like you literally just swallowed the wrong pill in the Matrix and accidentally took the red one instead of the blue? 1 second your reality is fine, and the next thing you know you're dodging dizziness like Neo was dodging bullets. That unsettling feeling is called vertigo, and it can turn your day upside down, literally. Vertigo itself is not a disease, but rather a symptom of an underlying condition. It's the sensation that you or your surroundings are moving or spinning when there's no actual movement happening. Essentially, vertigo is a specific type of dizziness that can be both disorienting and uncomfortable. Imagine standing still, yet feeling as if the ground beneath you is shifting or moving. This disorienting experience can make even simple tasks, such as walking or picking up objects, challenging. Vertigo episodes can be brief, lasting just a few seconds, or they can persist for much longer, significantly disrupting your daily life. Understanding what vertigo is and recognizing its symptoms is the first step towards finding effective treatment. To truly understand vertigo, we need to look at what's happening inside your body. Most cases stem from problems in a crucial part of your inner ear called the vestibular system. Think of this system as your body's gyroscope. It plays a crucial role in helping you maintain balance and spatial orientation. The vestibular system consists of 3 semicircular canals and 2 otolith organs, all filled with fluid and lined with tiny hair cells. These structures send signals to your brain about your head's position and movement. When you move your head, the fluid inside these canals shifts, causing the hair cells to bend. This bending action sends nerve signals to your brain, informing it about the direction and speed of your movement. However, when something goes wrong in this system, it can lead to the disorienting, spinning sensation known as vertigo. For instance, if tiny crystals inside your ear become dislodged, they can interfere with the fluid movement and send false signals to your brain, making you feel dizzy. Several factors can cause vertigo, and some people are more prone to it than others. One of the most common culprits is benign paroxysmal positional vertigo, or BPPV. This occurs when tiny calcium carbonate crystals, called otoconia, become dislodged from their normal position in the inner ear and migrate into the semicircular canals. These rogue crystals send false signals to the brain, tricking it into thinking you are moving when you are not. Imagine those crystals as tiny troublemakers, creating chaos in your inner ear and making you feel like you're spinning. BPPV episodes are typically triggered by head movements, such as rolling over in bed or looking up too quickly. Symptoms include sudden, brief episodes of vertigo, dizziness, lightheadedness, nausea, and unsteadiness. Another potential cause of vertigo is Meniere's disease, also known as endolymphatic hydrops. While the exact cause remains unknown, it is often linked to an imbalance in fluid pressure within the inner ear, leading to an abnormal buildup of fluid in the labyrinth. This buildup triggers episodes of vertigo that can last from several minutes to a few hours. It is typically accompanied by a feeling of fullness or pressure in the affected ear, persistent tinnitus, and fluctuating hearing loss. Unlike BPPV, which causes brief position-related dizziness, Meniere's disease results in longer, unpredictable episodes that can significantly disrupt daily life. The next 2 causes of vertigo stem from ear infections that affect balance and/or hearing. The first condition is known as vestibular neuritis. The exact cause of vestibular neuritis is often unknown, but it is related to a viral infection or other inflammatory process that affects the vestibular nerve in the inner ear. This infection disrupts communication between your inner ear and brain, leading to sudden and intense vertigo, nausea, vomiting, and balance problems. However, unlike other infections, vestibular neuritis does not cause hearing loss. The second and closely related condition is labyrinthitis, also known as otitis interna. It is a viral or bacterial infection that causes inflammation of the entire labyrinth of the inner ear, disrupting both balance through the vestibular system and hearing through the cochlea. While symptoms are similar to vestibular neuritis, labyrinthitis also causes hearing loss and a persistent ringing sound in the ears, known as tinnitus. Beyond infections and structural issues, head injuries and concussions can also disrupt the vestibular system. When the brain experiences trauma, especially to areas like the brainstem, cerebellum, or the inner ear, it can cause sensory signals to misfire. This miscommunication may lead the brain to misinterpret motion or position, resulting in symptoms such as lingering dizziness, debilitating vertigo, motion sensitivity, and difficulty maintaining balance. These symptoms can persist long after the initial injury has healed, making recovery both physically and mentally challenging. Another major factor that contributes to vertigo is stress and anxiety. Chronic stress triggers the release of stress hormones, such as cortisol, which can affect the autonomic nervous system and alter blood flow to the inner ear. Elevated cortisol levels can disrupt the normal function of your vestibular system, leading to sensations of dizziness, imbalance, and even a feeling of floating or unsteadiness rather than true rotational spinning. People with anxiety can even develop vestibular migraines, a condition where stress triggers migraine-associated vertigo episodes, causing dizziness, vertigo, and balance issues. It can occur with or without a headache and may also be accompanied by aura symptoms, such as visual disturbances. It's important to note that while people of all ages can experience and suffer from vertigo, it's more common in older adults. As we age, the efficiency of our vestibular system declines, making us more susceptible to balance issues and vertigo. Fortunately, vertigo is not something you have to live with forever. Physical therapy, specifically vestibular rehabilitation therapy or VRT, is a powerful science-backed approach to retrain the brain and restore balance. VRT is a specialized form of therapy designed to help the brain adapt to changes in the vestibular system and learn how to correctly interpret balance signals once again. The goal of this therapy is to promote neuroplasticity, meaning the brain's ability to reorganize and create new connections in response to injury or dysfunction. Through repeated exposure to certain movements and exercises, the brain gradually learns to compensate for vestibular deficits and reduce dizziness. Depending on the underlying cause of vertigo, vestibular rehabilitation therapy techniques are carefully tailored to address specific deficits and help restore balance and stability. One of the most effective techniques in VRT is the canalith repositioning maneuver, commonly known as the Epley maneuver. This technique is used to treat BPPV by guiding dislodged ear crystals back to their proper position within the utricle, where they can no longer interfere with balance. This maneuver involves a series of precise head movements that use gravity to move the crystals out of the semicircular canals. Many patients experience significant relief after just 1 or 2 sessions, though some may need multiple treatments for full recovery. Beyond repositioning maneuvers, VRT also incorporates a combination of gaze stabilization exercises, habituation exercises, and balance training. Gaze stabilization exercises, such as the vestibulo-ocular reflex or VOR exercises, help improve the brain's ability to keep your vision steady while your head moves. This is particularly beneficial for people who experience dizziness when turning their head or looking around quickly. Habituation exercises gradually expose you to specific movements that trigger dizziness, helping your brain adjust and reduce sensitivity over time. This method is highly effective for those whose vertigo is triggered by motion, such as rolling over in bed or looking up. Balance training also plays a crucial role in strengthening muscles and improving coordination, which helps prevent falls and enhances overall stability. Therapists use dynamic exercises such as standing on unstable surfaces or walking with head movements to help patients regain confidence in their movement. So, if you feel like you've been stuck in the matrix, remember, there is no spoon. It's not real, but your balance can be. You just have to believe there is no dizziness either. With the right treatment, your brain can rewrite the code to process balance signals, helping you regain stability and confidence in your movements. A physical therapist, the true architect of balance, can welcome you back to the real world. No need for a déjà vu moment every time you stand up. Conquer your balance and land your moves like you just hacked the jump program. Until next time, bend reality, don't let it bend you.
Be sure to like, comment and subscribe to watch more of Dr. Yaz's PT videos.